Welcome to our podcast, Face It, the reasons why you should FIBB. If you're listening to this podcast, you're seeking information about how to age gracefully and how to age naturally. My name's Ryann, and I'm the owner of Face It Botox Bar. I have a true passion for the medical aesthetics industry, and I'm a national allergen trainer and also a national Sciton luminary. Each week, we're going to talk about topics that will help you make decisions and motivate you and inspire you to be the best version of yourself. And we're also going to have a lot of fun along the way. These services will help you obtain results where everybody will notice, but nobody will know. Hi, it's Ryann, the owner of Face It Botox Bar, and I'm here with my bestie, Jen.
Marketing, social media, all that good stuff for Face It Botox Bar. So we are back again. We're going to talk and dig deep into laser services and our anti-aging type services that we have here at Face It Botox Bar.
Yes, we are so proud to be the best anti-aging laser center in Florida, Fort Myers area.
Absolutely. And being from Florida, I'm from Florida, and the whole, sun and all that kind of stuff and all the different lasers and things that, are kind of entailed to help with anti-aging. So we are known for one of the top laser centers here and known for our innovative laser center as far as equipment that we have.
Yes, if we're going to do it, everybody that knows me, if we're going to do it, we're going to do it.
That's right.
Yes.
So Sciton Laser, BBL Hero, Skin Tight, MOXI, Halo, Clear V, all those laser hair removal. Yes, the Sciton platform. You really have joined forces, I guess I should say, with Sciton. You have become a national spokesperson, I guess, national trainer. Like, how did that all come about?
So back in 2019, I had gotten my hands on some equipment and some laser devices, and a good friend of mine, Dana Zeitler, who's in Naples, love her. We did a lot of training together. She told me don't buy any other lasers. She had worked for a plastic surgeon and used every laser on the market. She said don't buy anything else but Sciton. So I came home one day and I said, honey, we're buying our second house. We are buying our laser. And so we brought on BBL and Halo into the practice because being from Florida, we have a lot of patients that have a lot of sun damage. And I will tell you, it's transformed my skin. I cannot tell you, I haven't aged. And I'm 25.
This is anti-aging. This is anti-aging services.
The
we don't
best.
age.
And when I believe in something, it's incredible as far as how the Sciton has developed such incredible equiment that really can change skin, and it's super safe too. I love the safety profile of
absolutely.
it. And so I'm a big believer. I speak nationally for Sciton. I'm involved in some of the device technology, and we brought on laser hair when they brought on Bare HR. MOXI came out 2 years ago, and that's really, we can treat all skin types. So
and with you, I know that you don't like to talk about yourself, right? And these credentials and the trainings that you have, but honestly, like, that's huge, Ryann. Like, you go and you talk to people about this laser. Sciton has trusted you to talk about their laser. Not only that, to go train other people, to go train other providers, and train in-house your own providers that are here working with you. And I know that they are all like in awe because like this is a trainer and she's training us. And I mean, that's a big thing.
Yeah. So we have our secret sauce with lasers. We have our own protocol that we've developed with our BBLs. And I can guarantee you, patients come in here and they're like, I never got that kind of BBL. And so they really see a difference in results. We put extra love into it, extra energy into the skin. And that's really what sets us apart from other places. And I also developed FIBB lift training for injectables and laser. So I am training on the weekends, even driving up to Jacksonville at some plastic surgery centers, but all over Florida, for
We're going to have to
training.
dig into that.
Yes, well, that's another
yes.
whole other topic.
I want to get into that.
Because I love training. You know, these devices are so safe and can really transform patients' confidence and just the way they don't have to wear makeup anymore. You know, we have patients that say that all the time. And so there's some science behind, which I'll get into later, about why I love them so much, but really results driven. I've always said that at FIBB, we're results driven. And you're a good example. I mean, we'll post her before and afters, but even after one BBL, she came to me and she's like, oh, I have freckles. And I was like, no, you don't. That is sun damage. And look at how her skin glows. So, and, you know, collagen stimulating, anti-aging helps repair the elastin and collagen and tightening too.
Well, the lasers are good for the people, like we said before, that don't want the injectables and things like that. So it's huge.
Absolutely.
I want to talk about, because I know that you love the laser stuff. Like that is huge. And I hear you talk about it all the time to all of our patients and stuff. And there's like different myths and things like that. What can you tell us about some of the myths of lasers as far as, or maybe how Sciton, because you're a believer, I'm a believer of Sciton as well, how that's maybe different from some of the other lasers.
So when we do consults with patients, and I'll, we giggle about the BBL. It's not a Brazilian butt lift.
No,
it's a broadband light treatment. So that's a photofacial coined by Dr. Bitter, who is a dear friend of mine. He's done some clinical studies on how the light actually is anti-aging, changes gene expression. But there's, different options. When you talk to patients, they're like, oh, I don't want to do laser. I'm afraid of laser. But then when they really, we assure them, we show them before and afters, and we do a true
where
consultation.
your reveal comes in.
Yes, and we have a reveal imager that shows people their sun damage. So when they come in for their consultation, we do that on every patient. They're like, oh my gosh, how do I fix that? Who doesn't want clear, brighter, more youthful skin? Get rid of, the brown spots. That's really a big thing in Florida, those liver spots. Anti-aging, collagen stimulating, tighter skin.
Right.
And so as we're doing these treatments, we have different modalities that are kind of good, better, best, less aggressive, more aggressive. And so how do we, how do patients decide what to do? So some of our treatments that we start with was the BBL, and that's what Jen did originally.
Yep. Who's good candidates? So if we're going to talk about the BBL hero, who's a candidate for that kind of procedure?
Every patient. There's different Fitzpatrick types, and a Fitzpatrick is like from a blonde hair, blue eye, all the way to like African American skin.
Okay.
So you got to be careful with those, of people with Asian descent. Although we do Fitzpatrick's 4, you can do them safely with the Broadband Light. You just really have to know who your provider is. Broadband Light is actually the world's most powerful IPL. A lot of patients know about IPL,
right?
Not BBL, although, as Sciton has expanded, people are more knowledgeable about that. But that you really can't treat patients with skin type, 5, 6.
Okay.
And that's why MOXI was developed. It's more of a resurfacing laser.
Okay.
And so those patients that come in, everybody's a candidate.
Right.
As far, even in your 20s.
Right.
For forever young and forever corrective procedures.
So, and I think, because I know you've spoke, obviously, and I've had treatments, you kind of recommend the 3 treatments.
Yes, up front for corrective.
Right. Like every 3 months or 3 times a year is kind of the protocol. No downtime with BBL. Some peppering, I guess we call it, that you have from it, wearing sunscreen afterwards. As far as how long is the procedure?
So typically we tell people face, neck, and chest we recommend, because you don't want your face being a different decade than your neck, chest, and hands. And you can also do your body. Typically like 25 to 45 minutes.
Okay.
There's no numbing involved. It's light energy. So Broadband Light is light energy. It's not actually laser. So we put ultrasound gel on. You have your goggles.
Full goggles, yep.
And then they'll feel like, that it's about 25 minutes to 45, just depending on what areas. And then they'll feel like a sunburn. They'll be pink-ish, feel warm for about an hour. Okay. And so there's really no social downtime. They can put on scented sunscreen.
Right.
And then from there, we see them back in 2 weeks. We do another reveal. They will get some peppering, or that's salt and pepper. And just, it's a really easy process.
And that's good for everybody, like you said. So your next thing, if someone's like, hey, I want something a little more invasive, I want to treat more something deeper, that's where the MOXI comes in, right? Take us through that MOXI journey as far
so
as procedure.
MOXI came out on the market about 2 years ago, and again, for we can treat Fitzpatrick 4, 5, 6
All different,
safely.
yeah.
So MOXI is actually a laser. It's a non-ablative laser. It goes. We talk laser talk, and everybody's like, "What's that?" So 200 microns is 2 sheets of paper deep.
Okay.
It is. We see a lot of skin conditions such as melasma. MOXI is a really good procedure that's safe for melasma because it's not putting too much heat into the skin. Melasma, you have to be careful of the sun and heat. Okay. We have incredible results of patients that have totally transformed their skin. They're not even wearing makeup that have had severe melasma.
We call it like the lunchtime laser because it's, how long is it?
7 minutes.
7 minutes.
And you're numb for it.
You're numb, come in and numb, 7-minute procedure. Downtime, what does that look like in aftercare?
So social downtime is different for everybody, but you really look like you had sunburn, and then you get these little mends, we call it microscopic necrotic debris, where the, sun damage comes out and it feels like, sandpaper.
Like a cat's tongue kind of thing.
Yeah.
I've heard you describe that before. And so as far as that recommendation, is that again, every 3 months, 3 times a year, kind of, keeping up with that once a year? What is kind of a recommendation? And I guess it would just depend on, each person's individual, what they want, right?
Correct. So if a patient has a condition like melasma, I usually do a series of 30 days apart. Mm-hmm. And it also tightens pores, it polishes the skin. It was the Golden Globes, remember that?
Yes, yeah. That's right. We did, yes. Yeah, they did have that. That's right. Yeah. You can also do a BBL MOXI at the same time.
Yes, we call them, so Sciton has their SAX treatments.
Okay.
And so we oftentimes will do BBL pretty much with every BBL MOXI. Unless you have melasma, you have to just be careful. Definitely BBLs with every halo because you're getting superficial and then a deeper treatment. But yeah, so MOXIs are, especially right now, you can do it during the summer.
Right. Yeah, it is something you can. Because, a lot of times people worry about this, again, in Florida, in the sun, and like being out in the sun and sweating and all that. It's one of the lasers that you can do. You talk about the BBL Hero, right, which is more of their newer, right? Mm-hmm. Because I remember when you first did my first BBL, it was like the whole like stamping kind of thing.
Very slow,
right? Then they've kind of stepped it up. You've got how many BBL Heroes? How many BBLs do we have
7
here?
7 devices,
Yeah. So that's mainly that, and that's a quick kind of pass.
Yes, so it's a lot quicker. We put more energy into the skin. There's, more tightening that happens. People see a big difference in pores. Other skin condition we didn't talk about, but BBL Hero can actually pretty much cure rosacea. We have a lot of patients that have had rosacea, and they have the corrective treatment, and then they're doing it every 4 months. So the other thing to talk about is the BBL, the genetic study. So Dr. Bitter and some other colleagues, dermatologists at Stanford, did a genetic gene study, and I tell all our patients that. And they do see it, year after year. So every 4 months is what we recommend, having a BBL, because that corrective treatment's going to be anti-aging.
Right.
So it actually changes the way our skin cells age. If you and your daughters, if we took you and did a cellular biopsy and took Macy or Mara, did a cellular biopsy, but treated you for 11 years every 4 months, your skin cells would be, younger than theirs.
Listen, don't get them hooked on this. They're already wanting to facials, and you're a mom of boys, so for you to have a med spa is kind of is funny because you're a mom of boys. But my girls, they've already come in for facials. They'll get addicted on that. Next thing you know, they'll want BBLs.
We'll do a twin study with them, but who's going to pick not to do it?
That's right. Yeah. Flip a coin. Okay, you're not doing it, but you are. Yeah. So after the MOXI, I guess I call it the next big laser is our halo.
Yes.
Right? So tell us about the halo a little bit. That is definitely a little more, because I know I've had one, a little more involved, I guess I should say. I had some downtime, kind of did it over the weekend. I did have some swelling. Results have been amazing. I've had a couple now. But it's kind of the Mac Daddy.
Yes.
Right?
It's a step down from CO2.
Okay.
So halo, we do kind of good, better, best. And, with treatments, but, a lot of our patients are ready for the more aggressive. Like we have patients and they say, if I'm going to do it, I want to do something aggressive. And, some have had facelifts, some have had CO2, and you know what they say, I'm never doing CO2 again. So halo is a hybrid fractional laser, meaning it's fractionated. And if it's like mowing, so CO2 is like mowing the lawn. halo is like aerating the lawn because it leaves
Okay.
healthy
That
tissue
kinda
behind.
makes sense. Yeah.
So it kind of ablates the tissue like a little kind of tornado, and then that tissue will get necrotic and then repair itself. There's all kinds of scientific, fibroblasts and cytokines of healing, so that you will swell with.
And that's where you get those little mends, I guess you call them, afterwards. So how does that procedure work? They come in and get numb. Basically they numb for probably a good 45 minutes.
And we have the best numbing cream that patients are really comfortable. We also have Pronox, which is my anesthesia, background. It's just, it's anti-pain, which is anti-pain. They just breathe that in, and it really helps ease. Most of our patients don't even need it, honestly.
I think some kind of get like, okay, what's this entail? And then once they're there doing it, they were like, okay, that wasn't,
So it is like the worst sunburn ever.
It is.
Yes.
It is.
I do 2 a year and 2 MOXIs a year.
But the results, so how long does that procedure take as far as the halo?
So again, most of our patients do face, neck, chest, and then we throw in the hands.
Nice.
Because you want everything to be,
Right.
look similar in the aging process. And it does tighten. So a halo does actually have the effects of tightening by stimulating collagen. So that's about, usually 2 hours. They're here probably a total of 3 hours with the numbing.
Okay.
And then when they leave, they're going to be red and swollen. So that, the healing process is about 7 days because most of them are getting aggressive treatments. You'll have swelling for about 3 days. That's the histamine response. Our medical assistants are really good at instructing, and we call our patients, day after day to help them with the process. Also included in that, they come in 5 to 7 days, and then 2 weeks later for a post-halo with our incredible medical estheticians who really show them how to care for their skin.
That's super helpful too, because if they have any other questions or if they're not sure if this is what's supposed to be happening, I think it's great and it's good follow-up because I think the patients like that as well. Our MAs are great about calling and checking on people. You've set up a great little protocol as far as how to do that process. So, the lasers, again, the Sciton lasers, you have invested a great amount of time, financial, knowledge to that platform and they've been great to you. They have a great support system. You, again, going around and training and bringing that kind of knowledge to Face It Botox Bar. So, when you come here and you're getting these treatments, you're getting somebody that not only believes in that equipment, the other providers believe in that equipment, and those patients are getting treatments from somebody that's nationally trained for that.
Yes, and I will give Sciton a little plug. When I first bought the equipment, I was, a month later, I did a master course with Dr. Bitter. I did John Hootman's laser physics course. Again, I dive in deep, and I'm going to do it, right, 110%.
You are, absolutely.
A little cliche saying. So Sciton really has given me an opportunity to really learn about this and really, again, results driven. And any type of laser that gives results, and Sciton is one of the best in the world. So
I agree. I've had the treatments with them and I enjoy it, and I'll obviously continue getting them. So if you want some more information on lasers, any of our laser treatments that we have, you can visit us on www.faceitbotoxbar.com.
And on Instagram and Facebook, we have a lot of video.
Yes.
We do a lot of video footage so you can actually see what the process is.
Yep.
And
before and afters.
Call us for a complimentary consultation. Come get a complimentary skin analysis at 239-322-3815.
Do you fib?
We fib. We all fib, and we all should.